Welcome back. We're pleased to have with us today Dr. John Halamka, who's a physician and a professor at Harvard Medical School. Doctor, welcome.
Thanks so much.
Thank you for your time. Dr. Halamka leads innovation for Beth Israel Lahey Health. He previously served for over 20 years as the CIO of Beth Israel Deaconess Healthcare System. Doctor, we were just talking before we got on camera that you've been traveling quite a bit and that it's not unusual for you. Tell us about what you've been doing on the road for the last couple of weeks.
Sure, so for the last 30 years I've worked at the intersection of technology and medicine. Today the problems throughout the world are actually fairly similar. We have aging societies, low birth rates, not enough doctors to go around, and not enough money to fund those who are going to need the care in the future. So what's the answer? Digital health.
That's fabulous. Now, as you've been working on this in your role at Beth Israel, you're responsible for all clinical, financial, administrative, all that IT. What are you seeing that is working at Beth Israel that you think could be applicable more broadly?
So we're going to look at broad categories of technology that are changing the way we practice medicine. Mobile, for one. Patients and providers aren't sitting at a desk using a desktop. They're computing wherever their phone is. And so you need to think about a strategy that's phone first. Cloud. People want data everywhere all the time. It should not have geographical boundaries or restrictions. And increasingly you're seeing wearables and home-based devices, and you need to figure out what to do with that data. No one's quite mastered where it's going to get stored and who's going to look at it, but it's certainly a trend.
In terms of these different silos that you describe, how close are we to having these silos actually interoperate and talk to each other?
For the last 20 years, I've worked in the Bush administration and the Obama administration as the person leading the federal advisory committees on interoperability on this data exchange challenge. How about this? Our trajectory is good, but our position isn't quite perfect. That is, we're sharing more data than ever before, and we have a path forward to share more data, and it gets better with each passing year.
And how much of that do you think is controlled at the state level versus federal level legislation?
Well, how about there are three factors. One is technology. Actually, our technology is good enough. Second is policy. To your point, there are state barriers often to data exchange. But most importantly is psychiatry. It's a question of will or reluctance to share the data because it's my data. It's valuable. You can't have it.
That's interesting. To the extent that there are cultural barriers, are there countries that are doing this better than we're doing it?
So if you look around the world, there are exemplars of pieces of interoperability or digital health. And let's look to Israel. So Israel has, for its very nature, needed to exchange data as patients who might be in a traumatic event go to a medical center. It's pretty straightforward to get the data from other medical centers. It's a political urgency. So you've got a national healthcare identifier, you've got cooperation, and you've got the use of standards. So they've done it well.
That's fascinating. In terms of industry participation, we talked about government participation. What are you seeing there in terms of industry? Are you getting the type of buy-in, the type of enthusiasm that is going to be necessary for this to succeed?
Seeing an explosion of entrepreneurial activity in the digital health space. And so, for example, do I believe that the major incumbent multi-billion-dollar IT companies are going to be the innovators? No. It's the two 26-year-olds in the garage that are writing an app in a weekend. I'm a mentor at one of the accelerators, Mass Challenge, our state's accelerator. We get 500 applications for 60 slots every year, and all of these are credible digital health innovations.
That's fabulous. And then in terms of, from academia, as you straddle both worlds, what are you seeing in terms of academic progress?
Right, so the academic work is on such things as how do we protect your privacy? And this is hard. Right? So what if you say, I want to share my data, but I don't want my HIV status or my mental health status or substance abuse shared? Well, that's kind of hard to figure out how to chop up your medical records so you can share just what you want with whoever you want it. So A new strategy is we're going to deliver all the data to you. You decide who gets it and for what purpose. And a lot of academic projects in that regard.
And do I, as an individual consumer, know how I should parse that data? Who's going to help me?
Well, and again, you raise this amazing question. So if you're a digital native, if you're 20-something, chances are we give you an app, we show you data on the app, you could figure out what to do with it.
Right.
If you're a CIO or a professional in the tech space, probably that's easy too. If you're an 81-year-old who doesn't have what I'll call digital comfort, you'll probably want to delegate it. That could be delegated to a service, a third party, we'll call it a care traffic controller, or maybe a relative, or a friend. And so as we engineer these solutions, we have to meet the patients at their level of digital comfort.
And how is that information getting translated to industry, translated to academia, translated to government? How are the needs of the patient becoming comprehended and digested?
Oh, excellent question, because there are guiding committees. Today at this conference there is the Society for Participatory Medicine, which is a patient-driven, what is it we need kind of group. But I have worked in these various federal and state advisory committees that always include patients and families as we guide the strategy for our region and the country.
That's fascinating. So as you talk about telehealth and the adoption of telehealth, what's realistic for people to expect in the next 5 years in terms of our ability to conduct legitimate medicine, have legitimate conversations that are helpful conversations with physicians?
Well, William Gibson told us the future's already here. It's just unevenly distributed. I do 900 teleconsultations a year myself. Why? I am the nation's expert on poisonous mushrooms and plants.
Right.
Anytime in this country there's an ingestion, I get a photograph on my phone and do a care plan. So hey, that already exists. And you're starting to see major companies like Kaiser or Mayo Clinic offer virtual visits and teleconsultations. In terms of it becoming mainstream, the reimbursement issues still exist. And so, but within the next 5 years, absolutely I expect a lot of our care to become less in person and more in the home.
Terrific. Thank you very much. We've been speaking with Dr. John Halamka, physician and professor at Harvard Medical School. Doctor, thank you for joining us.
Thanks so much.
The 2019 Converge to Accelerate conference is brought to you by IEEE, the world's largest technical professional organization for the advancement of technology. Boehringer Ingelheim, passionately working to improve healthcare. NASCO, advancing digital health together. IPSI US, the Association of Independent Workers, for one, for all. Partners in Digital Health, publishers of the forward-reaching blockchain in Healthcare Today and Telehealth and Medicine Today. Special consideration to iWorker Innovations, taking the independent workforce to new heights. Connected Health Conference, designing for healthy habits and better outcomes. Haven Health Solutions, providing true blockchain transactional interoperability. Special thanks to Seaport World Trade Center for hosting us. And a special thanks to 1-800 Public Relations for all your PR and media support. We'll be right back after these messages. Don't go away.